Yeah, there seems to be like just an a resurgence of the measles and just like little germies floating around everywhere. And I do my best to wash her hands and keep her clean and sanitized, but there's not much you can do. Unfortunately, kids get into everything, and everything they get into goes straight to their mouth. So
Well, first off, as a parent, you want your kids as healthy as possible. And so you trust the professionals that are in those environments to offer that, and if you're a family like mine, we believe in, prayer, and we believe that God can take care of all of those issues. But he also put people in place as far as doctors and nurses and things in the healthcare field to offer their expertise. And so if it'll allow my boys to be healthy, then 100%.
Those were concerned parents with questions about Arkansas's measles outbreak. Thursday, the first two measles cases in Arkansas since 2018 were confirmed in Saline and Faulkner County. This comes amidst growing measles outbreaks across the country, now infecting 25 states in 2025. I sat down with Dr. Hopkins with UAMS to discuss the disease. Dr. Hopkins, thank you so much for joining me today. This has been heavy on a lot of parents and families' minds as these measles cases have come forward. What's something that people need to know? How do you find out that you have measles?
Well, first and foremost, most of us hopefully are immune to measles. All children should be immunized for measles starting at 1 year of age. They get a first dose between 12 and 15 months and a booster dose between 4 and 6. And so all of us as adults who are vaccinated should also be immune. People born before 1957 almost all had measles, and so they should be protected. So if you're vaccinated against measles, or if your children are vaccinated against measles, this is really not anything to worry about. The issue to worry about is families and children who have not been vaccinated need to be concerned. The
Should
two
parents
cases.
of should parents of young kids, if they're under that 1 years old, go ahead and reach out to their pediatrician if they have an 8-month-old or a 6-month-old that they may want to get vaccinated?
Well, generally not at this point. Now, we've only had two cases in Arkansas. Both were associated with travel out of the state. So healthcare institutions that have taken care of these children and the State Department of Health are reaching out to potential contacts of the children that have been identified with measles with information about who needs to be either tested or given MMR vaccine or potentially other medications. So unless you are or somebody that's been contacted, I don't think it's a reason to rush out for those children under 1 year of age.
Right now, there's a lot of misinformation out there about the measles. How contagious is it, and what does it look like if you do contract this?
Measles is extremely contagious. It's the most contagious infectious disease we know about. In general, measles, you get contact with somebody that has the disease, and somewhere in the neighborhood of 10 days to 3 weeks after that, you develop what's called the three C's: red eyes, cough, and coryza, which is runny nose and runny eyes. After that develops, following that a few days, you develop a rash. But the challenge is really for the issue, the biggest concern is people that have not been vaccinated. Measles is essentially 100% protected by anybody who's gotten 2 doses of the measles, mumps, rubella vaccine. The vaccine is safe. The vaccine does not cause measles. The vaccine is very effective. 1 dose is 93% protective, and 2 doses is over 97% protective. So if you haven't been vaccinated as an adult, or if you have a child 1 year of age and older that hasn't been vaccinated, reach out to your healthcare professional right away and get vaccinated.
We're starting to see these cases. One of the children was confirmed to be an unvaccinated child, and we've been seeing a trend in the last couple of years of parents' distrust in vaccines. Do you think this is one that they should definitely consider getting for their kids?
I think it's one they definitely should get. I've been vaccinated. My wife's been vaccinated. All of our children have been vaccinated. I wouldn't recommend recommend anything for somebody that I wouldn't do the same for myself and my family.
Definitely. Is there anything else you want people to know as we close out here?
Well, just pay attention to your kids, keep them well. If you have a child that has symptoms, or if you have a child that's potentially been in contact with one of these families where we've had measles cases, contact your healthcare professional by phone. Don't just show up ideally in the office or the ER, because if you have the disease, you can potentially spread it to others. So let's keep in contact with our healthcare professionals. Let's take care of our families, and let's all stay safe.
Thank you for your time today. We always appreciate your insight. And like you said, let's stay safe.
Happy to do it. Thank care.
Thanks.